Okay, let's talk about the situation right now. So we pushed through the Omicron wave. So many people were infected with the virus. So now that they've had it, can they feel confident in their ability to not get COVID again?
Well, we know, and I've seen with our institute here and many patients that we see that people can be infected even after vaccination. The good news is that in the case of the Omicron, which is largely upper respiratory, meaning the nasal passages and the upper throat, that this will be easily controlled, and you may be reinfected after your first infection, but it's not going to be very serious. And I always point to the fact that, the coronavirus is the common cold. It's the etiologic agent or the cause of the common cold. This is a variant, of course, the COVID-19. But the common cold comes and goes, comes and goes, comes and goes, even though you may have immunity, and some people get it worse than others. So I am suggesting that the vaccine is covering you really well from having you wind up in the intensive care unit or in the hospital at all. Now, so that is very important. Now, the Delta variant, which is still going to be around, is very serious, and that's lower respiratory, that's the lungs. And so that causes major issues. And patients with Delta variant who are unvaccinated will wind up in the hospital and possibly the intensive care unit as well.
So that's interesting. You see Delta continuing to push forward as well?
Yes. And God forbid, new variants, which may arise at any time. But the good news is that we are 75% of the population vaccinated. So that will rebuff the new variants if any of them come about. The last variant was the BA2 variant of the Omicron virus variant. So if we see new variants, because our immune systems are so tuned up and we have almost herd immunity, and if you've been previously infected and even non-vaccinated, you are very protected immunologically speaking for a period of time.